Trial of the compressive craniectomy. Pathophysiology. Normal intracranial pressure in adults is below 15 mm of mercury, with transient increase due to coughing or sneezing. Intracranial pressure values that are sustained above 20 mm of mercury are considered to be pathologic in adults and an indication for intensifying treatment in patients with traumatic brain injury. Under normal conditions, the total volume within the skull remains constant and is determined by the sum of the cerebrospinal fluid, blood, and brain tissue compartments.
Craniectomy. What is a craniectomy? Craniectomy is a surgical removal of part of the skull in order to expose the brain. Unlike a craniotomy, in a craniectomy, the removed portion of the skull is not replaced. Hi, I'm attorney Robert Jarchi, and today's topic is craniectomies. Before the procedure begins, the patient's head is shaved and it's cleansed before the surgery. An incision is made upon the affected area and the skin is then pulled back. Small holes are then drilled into the skull, and a special saw is used to cut the bone between the holes and then remove the portion of the skull. In a craniectomy, that portion is removed and it's not replaced. Reasons for surgery. In a traumatic brain injury, craniectomies may be performed to reduce what's known as intracranial pressure, which can damage the delicate brain tissues. If the bone flap is replaced, the procedure is called a craniotomy. There are a number of reasons why the bone flap may not be replaced. For example, in traumatic brain injury, the brain may become simply too swollen for the bone flap to be replaced. In such circumstances, the bone flap may be temporarily placed into the abdomen, where it's preserved and protected until it can be surgically replaced later on. Alternatively, artificial bone can be used over the location where the skull has been removed. If you or a loved one has suffered a traumatic brain injury and you have any legal questions about your particular matter, I want to encourage you to pick up the phone and give me a call. I answer legal questions every day. That's part of my job, and I welcome your call. You can call me toll-free at 888-3100-LAW.
Traumatic brain injury is a medical and social problem worldwide with an estimated 10 million cases leading to hospitalization or death each year. In a low and medium income countries in which the use of the motor power transportation is increasing, the incidence of this condition is rising and involves predominantly young men. In contrast, in richer countries, the epidemiology of traumatic brain injury is changing because of two main factors. The rate of traffic incidents is increasing owing to social enforcement of safety laws and preventive measures, whereas the aging of the population makes such injury in the elderly more frequent. Signs and symptoms. Patients with idiopathic intracranial hypertension usually present with symptoms related to increased intracranial pressure and papilledema. Symptoms of increased intracranial pressure may include the following: headache, typical, non-specific, and varying in type, location, and frequency; diplopia, usually horizontal but rarely vertical; pulsatil tinnitus; and radicular pain, usually in the arms.
Quickest way to depressurize this is to take an area about the size of my hands on each side and carve away the skin, flap it over, go drilling in there, and then with a saw just buzz around this and take a section of skull out the size of my hands away. And what you're doing is then you can get to the brain and you can try to suck away the clumps of the drying blood. It almost looks like he's got some very strange mohawk.
Pros and cons. Pros. The surgical therapy of raised intracranial pressure includes the evacuation of mass lesions, drainage of cerebrospinal fluid, and the compressive craniectomy. Rapid detectation and timely evacuation of an intracranial hematoma is a cornerstone in the management of traumatic brain injury. Cons. Mild hypothermia, 32 to 34 centigrads, is effective in decreasing intracranial pressure. 33, but studies on the clinical benefit are contradictory, and current evidence does not support its general use in patients with traumatic brain injury. The effects of hypothermia are complex, and adverse effects are a particular problem in patients with traumatic brain injury who may require cooling for many days to control refractory intracranial hypertension. Issue applied in Ecuador. Globally, most clinicians who make neurotrauma assess intracranial pressure without intracranial pressure monitors and use intracranial pressure management protocols triggered by clinical or CT indicators. Rather than monitor pressure, this condition exists in many trauma centers in Latin America, in, in centers that do not practice intracranial pressure monitoring.